Hello, everyone, and welcome to this amazing webinar presented and put on by PsyMood. We thank you so very much for being with us this evening. We're going to be talking about men's mental health and the cultural taboo behind it. I'm super excited and honored to have Himmel and Alazar with us this evening. Gentlemen, thank you so very much for being here. I know you guys are extremely busy, so I thank you very much for being here.
Yeah, I'm really glad to be here, and thank you for inviting us.
Yeah, absolutely. So, you saw in the intro video a little bit about us, but we're going to go through a little bit more into detail, a little quick bio of each other, just so we can get the ball rolling. And what we'll do is we'll have a wonderful conversation. And at the end of the conversation, we'll start taking any of the questions that you may have that you can type into the Q&A part, as you saw in the intro of the video. So my name is Ross Wilson. I am the host of this event, and I am a chaplain and a mental health consultant. My background specializes in psychological first aid, the understanding and the concept of mental health and trauma from disasters and any kind of events that are traumatic in someone's life. So that's a little bit about me, and I wanted to introduce you to Himmel, and if you wanted to give us a little bit of a breakdown of who you are, sir.
Yeah, of course. Thanks, Ross. So my name is Himmel. I'm a psychotherapist, registered psychotherapist qualifying with CRPO. I work with many different mental health issues. My primary focus is on anxiety and depression and any type of emotional or mood related issues. My approach to therapy is integrative, culturally focused, and that's something maybe we can talk about it later on. Yeah, so that's pretty much in a nutshell.
Excellent. And Alazar, thank you so much for joining us. I know you're extremely busy too as well. So if you'd like to just do a little bit of an intro of who you are and your specialties.
Sure. Thank you, Ross, and thank you, PsyMood, for hosting this and having us on. So my name is Alazar. I'm a registered psychotherapist in the qualifying stage with CRPO, and I graduated from my master's program a year ago, and I've been working in private practice mostly, and seeing clients in a range of different issues and concerns, and I'm really passionate about helping people and making the best of it.
Absolutely. And I think, one of the greatest topics that we're going to be discussing is that cross-cultural kind of dynamic of men's mental health and mental health in general. But really, I think the biggest focus is, especially now more than ever during this pandemic, we are realizing the struggles that we are having, some things that we may have put away because we didn't really take the time to really focus on ourselves. And we're finding more and more that we're getting to understand ourselves now because we're spending so much time in seclusion or with our thoughts. So in regards to like men's mental health, what do you think, both of you, is the hardest and the biggest topic reason for them not to speak up and ask for help? Like, what do you feel is really stopping them from actually speaking up to ask for that support that really could benefit them in their present moment and in their future? What do you think?
I think that men are, think that talking about their feelings and emotions it shows weakness. It shows that they're, not good enough or not strong enough, and that really creates this, I need to man up idea, and I need to own up to my feelings, and I need to, just push them aside and continue with my day. I think is a big factor in why men don't want to speak up.
Mm.
Mm-hmm. Yeah, so I totally agree with Alzar, what he said. It's what does it mean to be a man,
Yeah.
right? So and I mean the biggest concern is, I mean it's a complicated question, requires probably complicated answers, but the biggest thing I would say, we don't ask for help, and what's the reason behind it? Why aren't we asking for help, right? So that, and let's face it, mental health affects us all,
Mm-hmm.
Regardless of your gender, right? But are we, as men, Are we going to therapy? Are we going to see a doctor, right? Are we taking care of ourselves, whether it's behaviorally, right? Whether going for a walk and stuff. Are we doing it because of our mental health? That's the question, right?
Yeah. Well, I think also, like, we talked about before, but also how I think of my upbringing is, my parents were divorced at 10 years old. So I didn't necessarily have, the father figure, that typical father figure around at all times, playing games and sports and kind of things like that. So I had to really dive deep into finding that kind of man, someone to look up to in the men's world, to how to be a man from different individuals that I would meet or through family, friends. And so, I think really having the proper upbringing, like being brought up with a father, I mean, obviously that plays a factor, but what happens if, you're divorced, families are divorced, and the father is not around as much? And I think for me personally, what happened is I lost that kind of fatherly, manly kind of look up to individual to kind of guide myself through my struggles, because, being with a single mom, she was doing the best that she could as a mom, but also tried to do like fatherly things, doing sports with me, playing games, trying to do her utmost to give me that kind of missing puzzle piece, right? So I mean, for me personally, it was very difficult to grow up not really having that role model. So I looked towards, movies or posters or, Arnold Schwarzenegger, bodybuilding. You look to these individuals as sort of like role models, but not knowing who they are. I assumed that obviously this guy looks amazing. He has no issues. Of course not. He has no issues. So obviously, if I have some issues, I'm not a man, because this guy in the poster or movies or TV or comic books will never express the struggles that they're going through. So I think surrounding yourself at a young age with that proper kind of dynamic is also a big factor too.
And then I think, Ross, I think we talked a little bit about that previously. Okay. It's like, Batman, Superman. Okay. Do they have, are they struggling, right? And we brought up Rambo, right?
Yeah.
And I mean, if you really look carefully, he probably has PTSD, right? But what does he do with it? He doesn't go and get help, right? Right. And if he did, how would we perceive that, right? So if and he said, as a child, you went to movies, and that's how you kind of like got close to maybe a male figure, right? But is it, is that appropriate, or maybe appropriate is not the right word, but is it helpful? Is it healthy? Right. So yeah, so that's an interesting topic.
Yeah, and to comment about when you mentioned about the upbringing, my family came from a poor country, and the responsibility of bringing food to the table came to men mostly at the time. And I think it's like cross-generational, where like the parents of the parents, they had to survive, they had to work hard, and there was no space for feelings, there was no time for it. You had to kind of suck it up and go to work, and otherwise you're gonna go starving. So growing up with that, that kind of transfers to the next child and the next child, and the cycle continues until someone in the generation that decides to kind of put a stop to it and say, okay, like I see my father figure and I see my grandfather, and they're not really speaking up, they're not really saying what's going on in their life, or their emotions and feelings. And so, and like you said, like the superhero stuff, we look up to them instead, because those people are not present in our life. So we look at someone from the outside, and we kind of project those same ideals that men do not talk about their emotions, men do not talk about their feelings. And so we're stuck in this loop of nobody's talking, and it's really hard to break out of it, or to know what to do with it when you never saw an example of it or something. So in this bringing awareness to men's mental health, and that it is okay to talk about the feelings, it's very important.
Maybe we can, if it's okay, we can talk a little bit about when people come to Canada from another
Absolutely.
country, right?
Absolutely.
And then specifically men, what happens to them?
Hmm.
Okay. So a lot of men, they probably used to work in their countries in a profession, right? Doctors, engineers, whatever, right? When they come here, what happens, right? What's the process of becoming a doctor or an engineer? What about the language barrier? Can they even do that? So I don't know about Elzer. You brought up that your family came here. It's the same thing with, I know so many people and my parents, it's a struggle,
Hmm.
right? But let's, since, we're talking about men, let's talk about, specifically what happens to someone, right? So from the literature that I came across, right, and it says that man relates to their employment or their career with self-identity, self-esteem, okay, and self-worth. So if you're an engineer back home and now you come here and you are not working as an engineer, you're working as a taxi driver, you're working as Uber driver, you're working in the restaurant, what happens to that self-worth?
Mm.
Right?
Yeah, I
So
think
yeah.
Yeah, I think that's
Go ahead.
a huge topic that I think that a lot of people don't really dive deep into is, when we have newcomers to the country, are they getting the same support as, say, someone who was born and raised here, right? And men in general. Let's, like you were saying, let's target and pinpoint the men coming from a country where blood, sweat, and tears, they worked. They, like you were saying, an engineer or a doctor, or worked in a warehouse or factory. They were built into you. Moment you wake up, you work, and you go to bed. You work, you go to bed. So they come to Canada assuming that potentially they'll be able to just transfer over that kind of mentality, that kind of psyche, to be able to go to Canada, which is a greater opportunity per se, and go into that kind of world even better. And then they find when they get here that the struggles just to be who they are from their home is so much more difficult. I mean, I can't tell you how many people I've met, even if it's through Uber, like, where are you from? What were you doing previously? The amount of people I've talked to who are engineers, doctors, architects that are doing Uber, and the struggles that they had just to get here, and then find out that they're struggling even more just to be who they are, training to be. I mean, that must be very difficult. I think that cross-cultural, transition from, where they came from, which could have been possibly a very difficult place to come from, expecting it to be an easy transfer over to Canada, expecting it to be like, oh yeah, easy, just a snap of the fingers, get right back into it with a better outcome, and realize it's not that way, And I think that's again a situation that we, in our world, and like in the world of psychology and therapy and support, I think is a topic that is not talked about a lot, because again, they're coming from a culture potentially that says, don't speak of this, like, don't mention your struggles. Like, I know you're struggling, but don't say anything. And I think that's a big trigger as well, I think.
Yeah, yeah. And like, and it could be challenging for even mental health worker or psychotherapist, right? If you're not culturally informed, because losing a job, you live here and you lose your job, it's different than someone who's coming from another country and lose their job. It's almost like they're losing their identity,
Mm-hmm.
right?
Absolutely.
So yeah, so I think this is, and you're right, and this is not, we don't talk about it much, and that's another something maybe we can discuss. Why don't we talk about it, right?
And to add to that, from personal experience, I came here to Canada as a teenager, and my self of identity back then wasn't based on my career, but more about my social life. So, break in my home country, I was, very social. I came from a small town. I knew everyone around me. I had a lot of friends, and then I come to this new place, and I don't know anyone. And then no one really wanted to talk to me as much, or I wasn't as open to it, and so I really started questioning, who who am I? Why would anyone want to talk to me? What am I doing here? How can I, assert myself into this community, into this society? Who am I even? That was a big thing for me, my identity in that. And I felt very lonely when I came here and facing those struggles and not having any friends. And so that was a big thing for me. And because nobody talked about those things, and nobody really, I never heard of anyone complaining about those things. I didn't really feel comfortable saying it or talking about it. So, I would just suck it up and try to, study, focus on studying instead of that. And that was a big kind of period of my life that was very, very hard on me.
It is difficult. And I think the kind of the foundation of like PsyMood is to be able to provide that support in a variety of languages. And I think it's key because, it's very difficult for me in some cases because I'm not fluent in French. To be able to provide that support in another language is very difficult if you don't know how to speak that personally. So obviously you're not going to be able to provide that support. Now, do you think, with newcomers to Canada and people coming to Canada in general to start a new life or, visit, things like that, do you find that because it's predominantly English and or French, or just mainly English, do you find that people from other cultures or other countries are reluctant to be able to seek help because of the language barrier? Do you think, both of you, do you think that's a big struggle, is the language barrier for having that mental health support?
100%. Even though in my home country we studied English since grade 1, when I came here I could not to communicate properly or talk coherently. So I definitely turned into people that had the same background than me and had and spoke the languages that I spoke. Even in classes, teachers were putting me next to students who were speaking my language. So that definitely was a huge part of when I came to Canada to help me kind of get accustomed to it and meet people. And that definitely is huge support to be able to speak the language.
So yeah, so that's something you brought up, Ross, language. But I personally think, it's not just about language. I mean, language is a big part, but it's also about the culture itself. As Westerners, do we understand their culture, right? Now let's look at the psychology. Let's open a psychology book, okay? The personality traits. Let's look at assessment criteria, okay? What are they based on, right? It's from a Western perspective. Do they bring in the cultural aspects of it? Well, they started now, but it's very, very little, right? So for us, it might be normal, but in some cultures, it is totally normal. Okay. Then how can we, without having those discussion, how can we say, okay, what he's doing, his behaviors are not normal?
Yeah. I think the cultural relatability and understand, like you were saying, Hamel, was us in Canada or the Western side of the world, we're not in some cases fully aware or educated in regards to other people's cultures, religions, faiths, spirituality. So it's very difficult for some of us, like myself, who are not really familiar with the cultural upbringing. And we want to do the utmost to be able to provide that mental health support, but also providing dignity and respect without trying to say, I understand, and being relatable. Because, as a chaplain, there's so many faiths, there's so many spiritualities, there's so many aspects of someone's mental health in regards to their upbringing in the faith world, that being seen as weak is against faith or against God. Because again, if you are truly a believer, you will have no weakness because you have that faith behind you. And I know there's a lot of people that I talk to who are reluctant to speak to me because they're wanting to say, like, I'm struggling, but I don't want to feel that my God or my faith or my religion is going to see me as weak, because I just need that help. And I think, again, in our realm of mental health support and therapy and psychology and even psychological first aid, understanding that we don't know really all the answers. We don't know about all the cultures and faiths and religions, but what we can do is just provide that support the best respectful way we can. And we were talking about this before, like in regards to like the men's mental health side of things, is how rare is it to have therapists like you two gentlemen that are men, right? How rare is that? And I think, you know, as a kid, I went to therapy as a child, and my therapists 100% were female. So it was that struggle of, can you relate to what I'm going to say? Can you understand what I'm talking about? You know, and that must be very difficult for a man to come in front of a woman who is, as a man, you're supposed to be strong and you're supposed to be powerful and you're supposed to be the leader of the family. And then to speak to a female, I think a lot of it is reluctancy to do that, being seen as weak, you know, and it must be quite a struggle, especially in the world that we're all in, is that finding that male companion to be able to be that relatability, right?
Mm-hmm.
And I would add to that, you know, because, you know, back to what we were talking about at the beginning, that, when a father is not really speaking up about his emotions or sharing stuff then you're not used to speaking to men about your feelings and emotions. So seeing a male therapist and, you know, as an opportunity to talk about those things to someone, to a male, which many people never done before, it's a huge kind of change or a shift in the mindset that we are able to do that with other men, and it doesn't have to be, you know, with our moms or with women and things like that.
Mm-hmm.
Yeah, and sometimes, you know, it's I would say, well, coming to therapy is a big decision for a lot of people, right? And sometimes, you know, in my clinical practice, after a few sessions, we look at each other and then we get like, you know, I know like he would want to say something like, I should have been here 3 years ago, right? So, and we're trying to kind of like have this conversation. What stopped you from coming? Right. So, and one of them is like, okay, you know, it's like, I don't know which therapist will understand me.
Mm-hmm.
Right. And when I say, you know, which therapist will understand me, it's the inner, whatever you want to call it, darkness. It's inner, you know, insecurity. It's inner, you know, the cultural barrier. Whatever it is, this is deep stuff, and for someone to come and talk about it, it takes a lot. However, you know, if you don't have that space, right, where you can find a therapist who can relate, that even makes it way tougher.
Yeah. Yeah. And I think that's the key. I mean, you know, being seen as vulnerable or weak in the world of society, being fragile, like, you know, I'll go back to the idea of how we as men are potentially being brought up through society or through what we see. You know, we live in a world of social media where everything that you do, whether you know it or not, is being visible to the world. You know, even if you think that you're absolutely clear, there's no way people would find out, somehow there's always a way of finding out what's going on. And I think for me particularly is I was building up a persona to cover that kind of suffering that I was going through. You know, tattoos were a big thing for me because I knew growing up as a kid that if you're a man, you have tattoos. So tattoos obviously symbolize a man. If you have, you know, if you play sports, you're a man. If you go to certain movies, if you do all these things like that, you are basically being built up in this foundation of society around other men that potentially are suffering as much as you, but they do a really good job wearing a certain mask. So you're wearing this mask like a persona, and you're wearing so many masks because you're trying to, you know, distract people from actually seeing your true self, right? And that was one thing that I really just recently is trying to find the journey of self, is understanding that I could take off all these masks, that the tattoos didn't make me a man, playing sports didn't make me a man. It was the actual fact of admitting to myself and to my loved ones that I needed help, that I didn't know all the answers, and that, it's okay not to be okay. And I know that is a terminology that's used a lot, but it really is quite accurate. It's, if you're feeling down today, that's absolutely okay. But again, we're in a world of social media that, what are the odds of you seeing a man that was like Rambo sit down and say, I'm struggling with my feelings? It's very rare, right? So this new generation, the younger generation, are looking at these individuals going like, well, they don't have problems. They don't have issues in relationships. They're not struggling through life in general, the pandemic, everything is perfect. So if I'm feeling low, then I'm not a man, right? And I think society plays a big factor in that too.
Yeah, and like, let's say you mentioned a great example that sports and things like that make you a man. Tattoos, sports, and what if a man loves fashion? What if a man is into makeup or those things? Does that make them less of a man? And so what is it that defines a man if it's not those external things? And it's like you mentioned, those internal. Being able to say, I am vulnerable, I am struggling with my feelings, connecting to your loved ones or your friends, and opening up to those. I think that's makes you more of a man than anything else that you can do. If we are to put a label.
Yeah, I think, it's very difficult, especially, being who I am and covered in tattoos. I always had to think of my mentality was like, what, am I doing this because I want them, or am I doing this because, again, I'm still not quite there? Is there something in my mind that's not quite fully clicked on? So I'll cover it with a tattoo. And, I know throughout the pandemic, many men that were the epitome of strong. You go on their social media and there is no issues. They are like the epitome of muscles. They're like, they live in a gym. They are fitness. And for them to call me was a wonderful experience, because it showed that they just wanted to take that step, knowing that it was private, of course, but also knowing that they were allowed to be vulnerable and still be seen as a man. And I think, there's so many reasons that we could talk about for the reasonings why men don't ask for help. In some cases, maybe they don't want to see it, their partners see them as weak, maybe their relationship or their wives or boyfriends or husbands being seen as weak, getting support. And, it is very true. Like, even finding a therapist that is a man, or a mental health support person that's a man, will they still open up? And I think that's the biggest struggle, is trying to find that little bit of light in that kind of the world of darkness when it comes to mental health. Like, can we find it? Like, what is the solution, do you think, of getting men to speak?
Mm-hmm. Well, I think coming to therapy is a big part of it, right? But I want to kind of go back to what you were saying, Ross. So if I can ask you some questions,
Please.
What made you get the tattoos?
So for me personally,
Yeah.
the first tattoo I got was on my left arm, and I was with some friends, and I saw this guy with a tattoo. It was a big bear paw.
Mm-hmm.
And I was like, wow, that was like, this guy's a man. He's got a big bear paw in his arm. And watching him, work out and be in that kind of world of just like a manhood, come again, with a father figure that wasn't around a lot, I had to kind of pinpoint the individual that I wanted to grow up to be one day, right? And I got the bear paw, and I started to realize that the more tattoos you got, the more manlier people thought you were and tougher.
Mm-hmm.
Like, if you can go through tattooing, the pain and suffering of getting a needle into your arm over and over again, you obviously have strength, like courage, and like a shield that's made of titanium, but what people don't realize is a lot of tattoos that I took and I have and continue to get were experiences of suffering that I didn't know how to express. The only way I knew how was to feel the pain of the tattoo, symbolizing the pain that I was going through internally. So not only am I feeling the pain that I'm going through, but I'm covering it with something. And that was the biggest factor.
So if I understood correctly, Ross, you were covering your inner pain, by having tattoos.
Yeah.
Right. So I do a lot of mindfulness stuff. I do a lot of act. So here, it seems to me this is an avoidance, right? We are avoiding our pain. We are running away from our pain. So when we run away from our pain, what happens? Well, we get the short term, feeling that are good, or it feels good for the short term, but in the long term, the pain doesn't go away. Just keeps on adding up, right?
Yeah.
So to answer, kind of like to answer your question, sometimes, I tell my clients coming to therapy, okay, you might feel worse than before. What we're doing is we're actually getting closer to the pain. We're actually sometimes will touch the pain a little. Now, obviously, you and I, when we do this, we want to make sure that you're safe, right? So we don't do it too fast. But and I bring up the mindfulness stuff. It's basically we're not getting rid of the pain. Pain is inevitable, okay? But the suffering doesn't have to be, right? So what we're doing is we're being okay with the pain. So the feeling that you were trying to avoid, okay, by getting tattooed. So in therapy, what we do is be okay. You be okay with the pain, right? I mean, of course, we do other stuff and realize, things like, okay, what are our values and stuff like that. But so this is, and then sometimes it is a scary thing, okay. But again, we want to come back to maybe why a male therapist, maybe why a therapist who is culturally knowledgeable or experienced different culture, and that might be a vital thing for a lot of people, a vital aspect. And I think PsyMood is it's giving that platform for a lot of people. Okay, so yeah.
I have a question to both of you. As therapists, let's say there's a man who wants to share his feelings and wants to be open and vulnerable, but the people in his surrounding or even as a romantic partner do see it as weakness. Should they share? Should they not share? What do you guys think?
Well, that's a great question because, I can speak from experience being in relationships where I pursued and presented a strong man. I was wearing a mask of strength and really wasn't showing my vulnerability. So for me, if this individual actually saw what's underneath the mask, I would be so fearful of thinking that she would see less of me because I've already built up a persona of strong. So, but then I look at it this way: if this person is with you and you show your true self underneath the mask of all that kind of fake things and all that kind of acting tough, and that individual is not supportive of the decision and the strength and the courage it took for you to take that mask off and ask for help. If they're not supportive, in some cases, those individuals are not kind of part of your journey. Difficult as that may sound, because obviously in relationships, you never want to end it because of certain things. But I truly do believe that if you surround yourself with individuals that see your journey as for self-growth and not selfishness, because there's a difference between selfishness and self. Self is to find who you are, and selfishness is doing actions that are going to cause harm to others. So some people don't see the difference, but those who see that this is part of the process, I think, they will always be there with you. Those are my thoughts.
Mm-hmm. Yeah, that's a very interesting question, Elser. And I was thinking, a lot of my clients that I work with, it's their partner they ask them to go see a therapist. It's like, and the first session, I'm like, okay, so why, what can I, what's your goal? What can I do for you? And they're like, oh, I don't know. I'm just here because my wife told me to come. Okay. Half an hour into the conversation, we come up with so many things that are going on. Okay. So yeah, so it's and sometimes it is about, relationship is about communication, right? A lot of time, we're so focused on that context, right? What's going on, how to solve problem, and we ignore the emotional part. We don't even sometimes notice the emotional part.
Mm.
And then that leads to certain behavior that might have negative effects in your relationship, right? And your partner may notice that, and they're like, no, you need to go see a therapist. So from my experience, it's, I'd say it's kind of common, right? It's even for men, for most guys, it's like, why are you here? Well, because my wife thinks that I need therapy, but I have, I don't know what you can do for me. But then it's like after the first session, they keep booking appointments.
I think Hamel, you really pinpointed that one was, I would ask both of you, like when you have your male clients come in and for the first time, what would you say is the most common reason why they came in, or the reluctancy of coming in? Like, what do you think is like the first thing when you say, what brought you in? Like, what would you say is the number one thing that they say?
Mm. Um, they say they're fine. That's the thing.
Right.
Right. From, I don't know, what else their experience, but from my experience, they say they're fine, but they're here. And usually it's someone thinks that's a good idea. Usually, they just want to try it out, or they want to say to their friends or family they tried, and just want to tick off box. But I would say 100% of the time, it's like, it's not about that. When, if we can build that relationship, they realize that there's this thing that men are less able and less interested in building emotional and supportive relationship with others, and that's totally not true.
Mm-hmm.
Okay. Even they might think, oh, I have clients who would be like, oh, relationship, it's just, I don't want to talk about my emotions. Just because you don't want to talk about it, or you don't know how to talk about it, doesn't mean you don't feel it.
Right.
You feel it, you just don't recognize it. Or maybe you try not to, like you run away. Instead of noticing your feelings, you go and play sports, and you go grab drinks, or you get tattoos, right? So to answer your questions, more often than not, it's a common thing. It's like, I'm fine, I don't need help, but I'm here, right? And that's the surface. But when you actually go into it, one specific thing is they don't know what to do with their emotions.
Mm-hmm.
Yeah.
Yeah, I would say I have a similar experience with male clients where they say, I have nothing to talk about today, or nothing really is going on. And, as the session progresses, much like Himel said, they come up with so many different things that are happening in their life that they are struggling with, that is difficult, but kind of like that initial step to admit that something is going on, that something is bothering them and they're struggling in something is very hard to do. And that's why it's important to build that relationship and then trust in the therapist, and that relationship to make them feel comfortable to share those things and to admit that they are struggling with some things. And when you said about the husband who came in because his wife told him to, it's very much that many times those men don't feel comfortable opening up to their significant others or to the people in their life because they fear the judgment, or Ross, as you said, like taking off that mask is scary to really show who you really are to the people you love and to the people who you kind of put that mask on for so many years. It's a really difficult thing to do. So to come to therapy and to finally being able to kind of take it off and showing the real you or showing the vulnerable side of you is a huge thing, and it's very scary, and it definitely needs that space to grow.
Yeah, and it was quite interesting, like to add to all that too as well, that, previously when we were talking, Hamel, like, do you think the reason for the high rate of suicide in male is because of that fear of speaking out and asking for support and asking for help, or the potentially the lack of support in regards to, men's mental health? Do you think that's a big factor in that statistic?
I mean, I think so. I mean, let's look at the statistics. I mean, as far as I remember, and you can look at Statistics Canada, and 77%, I think that was the number that I looked up, is 77% of the people who commit suicide and dies from suicide are men. Okay. However, you look at, how many people are reporting for depression. Okay. Men has a very low rate compared to other sex. So, and we know there's a correlation between depression and suicide.
Right.
But this statistic doesn't make sense then. So what's the reason? Well, the reason is they're not coming and asking for help.
Yeah. And I think, being in that kind of precipice of mindset myself at a young age was trying to kind of think like, if I can't get the help, then I can't ever get help. And there's no real way out of this. And you feel so lost. And again, it could be, the way that you're brought up. It could be your working environment. It could be your relationship. It could be your cultural background. In the realm of like faith and religion, me personally knowing that kind of side of things, is the reluctance to speak about it is such a taboo in a way. Like, speaking about your mental health issues or the struggles that you're going through is actually worse in a way, because you feel like you're letting your faith down or you're letting someone down. So in some cases, suicide may be a easier way to go than letting someone down, like letting a upbringing down, a faith down, a religion down, a person. Some cases people would rather take that route instead of letting someone down. And I think also surrounding yourself with individuals letting you know that you're not letting us down. You're actually letting us down by not asking for help or not speaking openly with us. And again, it's that conceptual understanding of what a real man is supposed to be, right? Like, what is a real man? And I don't think we'll ever be able to necessarily pinpoint that, because everyone will have their thoughts on that, And so I think that's the hardest thing is, what direction do you take? Do you go to therapy like both of you are saying and say like, I have nothing wrong. There's nothing wrong. I'm here because my wife has told me, or my partner has told me, or I'm supposed to be here because work says that that's the case, but I really don't need help. So I'm just going to give you the time. I'm not going to listen. I'm just going to go out my way, And that's the struggle. I think that's the biggest struggle for us, is not necessarily to pull it out of them, because again, it takes time and we're all going through a process. But, for me personally, recently, I've used tattoos as an example of, why did you get it? What's the story behind it? And when you got it, what was the perceived idea for it? And sometimes they'll start telling you about the tattoo, which when will loop back to why they did it, and then their mental health issues beside it. So sometimes you have to kind of play like, where's Waldo with tattoos in some cases, or in their daily lives. Like, why do you go to boxing? Like, why did you start boxing? like all these kind of things like that. And I think that's the struggle, is trying to find that where is Waldo in their mind, saying like, what's the reason for you to be here or not be here, right?
Yeah, Ross, and I was exactly thinking almost the same thing. You know, a lot of time I see that clients come in and they will say, coming to therapy is almost like giving up,
Right.
you know. It's like, so what are you giving up? And I'm not man enough anymore, or I'm just giving up, right? So I mean, again, you said, like, you know, this process, you know, this is changing their cognition is a long process, right? So we talk about, you know, what are the benefits of even giving up, right? What are the, you know, if you don't, then what are, you know, if you don't seek help, what are the benefits, right?
Yeah.
And that's, you know, we you know, it's almost like, you know, as a therapist, I give them the space and they just put the stuff that they have been carrying, they're just putting it on the table, and then, you know, it's almost like they can have a better picture, you
Yeah.
know, they can have this self-realization and self-actualization. Yeah.
I saw this story on some TED talk that, you know, there's this boy who kind of didn't know how to show his emotions. So, you know, he said like his grandma passed away and he couldn't cry, and someone in his family got cancer and he really didn't know how to, you know, feel about it. And so, and then once, you know, he started struggling and things like that, the thought of suicide came in, and it's like, who will cry if I never cried about anything bad that happened in my life? Who will cry if I die or if I go? So it's kind of like, you know, we have this idea formed that, you know, if we don't show emotions, then no one else probably is showing emotions. That the world is kind of like emotionless in a way.
Yeah. And I think, you know, we have, which is amazing, we have, you know, Q&A, people are asking questions, and we have some great questions, like actually like really great questions that are, we're going to start another topic of conversation. But, you know, I think, to me, that I tell myself during this journey of self, and to people that I support and provide that need of just an ear, in some cases, not even a voice, just simply an ear, is whatever you say, whatever you feel, everything is okay. And everything is supposed to happen the way it's supposed to happen. And that kind of understanding the concept of, you know, being here doesn't make you less of a man, it makes you more of a man. And in some cases, you have to kind of bring them up to say, like, you are extremely tough to be here. You know, you may not want to be here, but you just being here, you had the opportunity of not literally being here. You could have just turned around. You could have just got in your car and drove off. You could have not even come into the direction. You could have never even phoned my number, but something brought you here. And that right there truly is the essence of like men, like, is that courage to ask for support, right? You know, and I think that's the biggest thing, is courage and being strong, like the thin line of what people think that might be, right?
Yeah. So is it, you know, are you being strong by seeking help, or are you being strong by not seeking help?
Yeah.
Right? That's the question.
Yeah. And so I think that, you know, we have 4 questions that we can chat about and see what we can come up with, and which is amazing. I mean, there's such wonderful questions here. So one of the questions is I'd like to ask about strong males that know about their mental health disorders, but still don't believe or don't accept the idea to go to therapy. That's a key one right there. Yeah.
Yeah. So, I mean, let's I can tell you about my experience, you know, being a therapist, like going through this journey. I always ask this question, even though I'm a therapist now: therapy, does this really work? Right? But if you look at the data, you know, you look at the literature, you know, the clinical literature, you look at neurological literature, right? it works. It works a lot of the times.
Yeah.
So, I mean, we can talk about, as a therapist, what we need to do to cater certain culture, right? Certain demographic.
Mm-hmm.
But I think we have years and years of data that indicates that therapy can actually, and then now their neuroscience is backing that up, right? We don't have to really rely on the clinical data, but they can actually show that the brain changes in your brain. So yeah, so what I would say is if you can look up some information, right?
Mm-hmm.
What's the effect size of psychotherapy? And depending on what disorder you have, right? So some of the disorders that I work with, even like things like eating disorders and stuff, or even anxiety, depression, therapy can play a big part for treatment and recovery and you feeling better and improving your life and lead the life that you want to lead.
Yeah.
I'll also say that accepting those disorders, and it kind of creates those labels within you. So you know it's really scary to kind of accept that you are suffering, that you are have those things that you need to work on, and then you need to seek help for. So um, therapy definitely can is a good place to start, even if the strong males don't accept the disorder or what's happening. That can give a better picture of what is happening, and kind of remove some of the fear that's surrounding that label and what that means, because often we don't really know what those labels or disorders mean, and how does it change your life or things like that. So that definitely is a good place to start with that.
Yeah.
Yeah.
Absolutely.
Yeah, I just wanted to add like one thing that's just popped up in my mind. It's like if I'm playing sports and I break my arm, okay, wouldn't I go somewhere to fix it?
Mm-hmm.
Right?
Exactly.
So if I'm struggling mentally, why wouldn't I go somewhere to fix it?
Mm-hmm.
Right?
Yeah. And I think in some cases, men are still unaware that this is an option of getting that support, because again, maybe in their lives or society or the individuals that they surround themselves, they're not aware of this, that this is an option for them. So a great question here, similar to what we were just talking about, is, this would be for both of you. I think, a little bit more towards that is, have you ever felt like men don't feel comfortable with male counselors or therapists because, they're afraid to talk about their issues in front of another male because it hurts their ego, like not being like Batman or Spider-Man or Superman? Do you find that that's a struggle?
It could be, I think, it could be, but again, is it a struggle because of an assumption, right? Or have you really experienced it? Right? So that's the question.
Yeah.
So if you went through 3 male therapists and it's keep on coming up, maybe try a female therapist, right? And see, because assuming is one thing, but actually experiencing it or gathering data might give you better information about yourself. And if this is the case, I mean, I don't want to get into too much about the clinical stuff, but then we want to talk maybe about your male figures in your life, right? And how, basically kind of like where this is coming from. And yeah, so definitely it could be, I'm not saying it, it could be a possibility, right?
Yeah.
Yeah, and I would say, like, when people choose a therapist, whether to go to a male or female, and there is a reason behind it. sometimes. And that reason could be that their whole life they wish they could talk to their dad. They wish they could share their feelings with their male figures in their life, and they're never able to. So this is kind of a way to achieve that in some sort, like a kind of a projection. So in that regard, like the ego is gonna play a role in kind of the therapeutic way that and the therapist can talk about of what comes up when you do open up to a male therapist. So it definitely can happen, and I think it's good if it happens, because then you can really understand yourself and your ego and what it is that really is kind of standing in your way.
Right. Yeah, I think that's a huge key. And I think also using your own personal experience as a kind of a preview, like an opener, to say like this and this was difficult for me as well, in the same position as you. And this is how I found a way of finding that courage to do so. So I think that's a big key, is sort of like sometimes your own personal stories are a great way of introducing that into the conversation. Another great question is, what are some tips to start deconstructing the stigma around mental health in society? I believe education has a massive role on it. Do you think people should start the conversation with children at home and in schools? That's a great question.
Yeah, that's a very good question, and yes, the answer is yes.
Absolutely.
As a father and brother, uncle, whoever you are, whatever your relationship is, um, I deal with a lot of emotional stuff, like emotional related disorders. So I would say validating one's emotion is important, right? So just don't go and tell me like you shouldn't feel sad, right? Or you shouldn't feel upset. That doesn't, that emotion doesn't go away. Instead, maybe validate that, and then work and figure out what would be the best option for this person, right? So yes, the answer is absolutely. And about stigma, again, education is very, very important, right? It's learning about mental health, learning about the brain, right? The things that we can do um, to take care of this machine that we have, right?
Yeah.
So I think that's very important. Yeah.
Yeah, I think as children, that's when the crucial time where we kind of build this world map of what what our loved ones mean to us, what relationship means, how can we interact with the world and all of that. So when we have a missing father figure, or when we don't get validated for our feelings, like Emil said, we build this idea of men shouldn't talk about their feelings, or our what we feel doesn't matter, or it's not important. And so I think it's huge importance to educate children when they're young to that the feelings do matter, that it's okay to feel them, and all of those things, for sure, like Emil said.
Yeah, and I think that's key too as well in regards to schools. I mean, I think schools should be introducing so many things at the young age to be able to help them, move forward the future. And I think the biggest thing is to validate and hear their feelings and thoughts, and let them feel comfortable knowing that what they're going through is okay. Because again, I think if you start at a young age knowing that your feelings are valid and what you're thinking of is valid and important, when they get older, they will still know that their feelings are valid too as well. So I think, yeah, it's a huge thing that I think schools for sure should definitely introduce this into it in some aspect of it from a young age to the college years as well. So this is a great question too, as well. What are some tips to make men or a person who are not comfortable expressing their feelings to open up to me? That's a great question.
Mm-hmm. Yeah. Yeah. So
yeah, what do you think?
yeah, that's a very good question. I'm trying to think outside of the therapy room, right?
Right.
What we can do, right? I mean, I can talk about my experience in the in the clinical environment, it says someone is not recognizing their emotions, right? And then I kind of go in and say, okay, so what are you feeling? And if you're not, you can't recognize it, then we get into like, what's happening in your body. Let's do an introspection, right? Bring your focus into your body. Okay, what are you feeling? And doesn't matter, you don't have to you don't have to come up with an emotional word. You can come up with any word you want: blue, red, yellow, right? I mean that, and then it goes into very I guess in depth, right? About, and then we're trying to figure that out. But from, I guess, outside of the clinical practice, okay. So one thing is I would say give them the space, right? Okay. We often and 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 the intention is might be that we want to do good to this individual, but we often what we try to do is try to solve problems. All right. Instead, maybe just give them a space where tell me how your day was. Okay. Okay. What are you thinking? What are you feeling? And just kind of give them the space. And often this is therapeutic, right? Okay. You can talk about whatever you want. Just talk. Any and I think I read it somewhere. It's like in any relationship, you gotta sit down and just talk and listen more than talk sometimes. Yeah, so that I would say, those are the things that I can think of outside of therapy. I don't know if Elzer has some more.
Yeah, those are great tips. I would definitely say do those things, and as well would add that people are different, and different people need different things to be able to express their feelings and emotions. So I think if you do care about someone, if you do want them to open up to you and express their feelings, I would say to us directly, hey, I'm really curious about your feelings, or really care about you, and I want to know everything about you. How can I help you feel more comfortable with me? How can I help you share those things with me?
Yeah.
So I think that even if they don't share it at the moment, they have this idea that you do care about them, and that you're there for them if they need you. So eventually they will reach out, and or tell you right away that I need this and that to feel comfortable to share those things.
Yeah, and then maybe get to know their love language a little bit, right? So some people, they like you and they will buy you rose, but then some people will say, "Oh, I love you," but then some people will do something a favor for you, right? So we express, how we feel in different ways.
Yeah. And I think, not, the hardest thing for me is not kind of going through my Freudian mind and answer these questions. Or if someone asks me a question, not go through the mind, I'm going like a Rolodex of answers. And in some cases, the best thing for me to do is just be present. And I think that's really key, is that if you have a friend that is in the process of wanting to get support or looking for guidance, just being present, being in the moment, being in that safe place of just saying, listen, you're in a position right now that you are absolutely safe and everything is valid. Everything is on the table. There is no judgment. And I am here strictly to be sort of like a microphone. Whatever you want to say is safe. And I think providing a safe place, whether it's in the realm of therapy or if it's in the realm of friendship, loved ones, partners, relationships, and family, I think the biggest thing for people, males specifically, is not feeling that they have a safe place to be able to express themselves. So I think, outside of the world of Freud and psychology and therapy, it's just providing a safe place. So I think for me, that's the biggest thing is that safety net, right? Yeah.
Yeah, and then I think it's also within the therapy, right? We
Absolutely.
don't right away get into, hey, how you're feeling, right? It's like providing that space, right? And that is safe and non-judgmental, right? And then like you said, and I think I totally agree, being there, right? Being as in like being in the present moment. Yeah.
Yeah. I think, this next question is quite relevant to PsyMood that's putting on this event, is that cross-cultural, that cultural support that, in some cases are not available. That's why they provided this service to be able to offer, the support that we give our, clients and patients, but in different cultural backgrounds and languages. And I think this is quite a relevant question, is what are the main differences do you see in how men's mental health is seen in a variety of cultural backgrounds? I think that's a great question, and it's very relevant to what PsyMood is trying to accomplish.
Mm-hmm. Yeah. So that's I mean, how many hours do we have to answer that question? I mean, but to kind of say that, it depends, cultures vary, right? So there are certain cultures you will see more stigma against mental health, right? And stigma, it could be a lot of things, but you can break it down to what is happening, right? In terms of how things were taught in their childhood, right? And sometimes even, let's say, they were born here, okay, but their parents or grandparents are from another culture, right? And now they have to cope with two different, it's like almost like having two different identities, right? It's like, okay, so at home you listen to Indian classical music, but outside you're listening to Led Zeppelin, right? And your friends wants to play hockey. Here your parents are like, hey, let's go take you to learn yoga, right? So how do you deal with that? So a lot of times, it's we also kind of have to include the family, right? The family aspects of it, right? So you going through anxiety, what does this mean to your mom, or what does this mean to your siblings, right? What do you think, they're thinking? And that's a challenge, you know, for them. There's a lot of shame. That's another emotion, guilt, right? For even coming to therapy. So those things we need to consider as therapists. I think, I don't know if Alistair would agree with me, but I think we need to consider these things um, when when people come to therapy, and also when people are thinking in their head that maybe they should go to therapy, but they're not sure if they want to, or if they're not, they don't have enough strength to go to, right? So when, and trying to figure out what's the obstacle behind coming to therapy.
Yeah.
Mm. Yeah, I would say like that I noticed that the similar things around cultural background is that the older generation, the grandparents, are mostly are not accepting of mental health, and this idea is very foreign to them. And that I noticed across many cultures, that this is a thing that I can't talk to my family because they don't understand. They think mental health is not really a thing.
Right.
Kind of the difference is what I noticed is that kind of like the collective society versus individual society, and the mental health regarding that is very different. So, in an individual society, the mental health is regarding your own self, yourself of your identity, and what you mean to the world, what your achievements are, and those things. But in a collective society, is very much about the people around you. Your mental health is taking a toll depending on how the people around you are interacting with you, how they see you, how other people kind of view your value and your importance. And that's kind of like the similarities, differences that I noticed across cultures.
Yeah.
Yeah. And that's what I was thinking. It's like different cultures is like, especially if it's collective culture, right? It's always we oriented, right? We do this together. Everyone's in everyone's business. So that's why coming to therapy, sometimes, we need to work out, what does this mean in your family, right? But
Yeah.
from a Western perspective, it's not making sense. You coming to therapy, it's for you,
Yeah.
right? Who cares what your family members and friends think, right? But if you were born in a collective culture, this is embedded in you, right? And just having that awareness is, I think, is very important.
Absolutely. Yeah, I think a lot of people, especially in, the Western side of things, don't kind of have that relatability of understanding that concept of like, if I go to therapy, we all go to therapy, because you want that support group. And in some cases in the Western world, that will be seen as, weakness, because you're telling everybody in a very safe place. So I think a lot of people do find that kind of difficult to do in the Western world, is to say like, hey, can I bring my entire family with me, right? Yeah. So we got actually a lot of questions, which is amazing. Here's a great one. Is there any different approach to treat mental health issues affecting men and women? Would you say that there's a different approach, or are they both very similar, or do you feel that some strategies are a lot different between male and female?
So approach, we have to kind of define what approach is, right? So if you're talking about modalities, probably not. Like we can use CBT for men and women, right? But the struggles are different, right? So, and I think I was talking to you, Ross, about, childhood abuse, right? How boys act up differently than girls, right? And girls usually have like common symptoms of, depression and stuff, but for boys it's like school dropout, it's like binge drinking, right? Risk taking, disruptive behaviors. So yes, we might be using this, similar modalities or same modalities, but the approach has to be different. You know, it has to cater towards that individual, right? So that's why I tell my patients or my clients, just because everyone else has anxiety and things that are working for you, it might not, but some things might work for you that other people would be like, what is that, right?
Absolutely.
Yeah, I would echo what Himel said, and that everyone is different. I don't cater it to men versus women, but more the individual that's in front of me, what he's or she is struggling with, and how can I help them kind of in the moment. And yeah.
I think that's also a great kind of discussion too, as well, especially because, it was, still is Pride Month. And it's a huge discussion in the kind of the LGBTQ community, is that mental health support. Now, would you both say very similar to someone who is going through kind of the struggles of understanding their sexuality, understanding how I can bring this to attention to my family? Do you find that it would be the similar approach to just that same we were talking about, or do you find it a little bit more in depth in regards to how you would approach this kind of topic in the LGBTQ community?
Yeah. So yeah, it's the question is, it's kind of, I'm trying to, so similar in a way. It's like, the approach, there's certain approach is going to be same. You come to therapy and it's going to be a non-judgmental space. Doesn't matter if you're gay, you're lesbian, you're bisexual, whatever, you're heterosexual, whoever you are. You coming here and getting a place that is safe and non-judgmental, that's safe, right? But your struggles, again, I said, it might be different, okay, in terms of trying to figure out who you are, right? There might be different aspects of it than for someone who has different experiences, right? So for example, let's say someone who uh, is not sure about sexuality, right? Comes from another culture,
Mm-hmm.
and that culture does not promote homosexuals or any other uh, sexual identity,
Right.
right? This is a different struggle,
Mm-hmm.
right? Than someone who was born here and brought up here in Toronto, right? That's going to be a different struggle. Someone compared to someone who grew up in a rural area within Canada, let's say, right? It's going to be different struggle. So yeah, so again, there are certain aspects of therapy, it's going to be similar, but then there are, other aspects it's not going to be.
Yeah, I would say like, the similarities of, the cultural stigma around it, and, the coming out, that's removing that mask and being yourself, as Ross, you mentioned, like with men and things like that. So it definitely is similar in that aspect. And, therapy can definitely, help explore those ideas and those different stigmas and things that, and the sexuality, and what does it mean, about us, or how does it define us even. And um,
Yeah.
uh,
It's a struggle, and I think it's a conversation that could go for so long, is that kind of understanding of a safe place. And I think the key to any of this is providing an environment of safety. I think that is the key, whether it's in our offices or it's at our home or even in a coffee shop or on the street, is providing that safe feeling of knowing, that's key, right? Is that safe place. So we have a few more questions that we'll go through. And these are, again, amazing questions. This one here is going back to the kind of the education side of educating individuals. How would you introduce like the materials? Like, I guess they were talking about like the mental health materials, like information, since the discussions need to be supported in the home as well. So would you recommend like materials? Would you recommend any kind of literature? What would you say are great resources to provide, like to help parents and loved ones or partners kind of understand what you're going through? Do you think that there's a resource or a material that they could provide?
Yeah, so it depends again, what age, right? So for children, I think it has to correlate with what their needs are, but even also like relationship couples counseling, right? There are different ways to kind of navigate these things, right? I mean, I can maybe what we can do is kind of post some of the stuff if you like, and I don't know if it's possible. I can't think of anything, but if you go to like CAMH, and they have a lot of resources on mental health. Um, Again, I deal with a lot of anxiety related stuff, so look into like mindfulness, how your brain and can change and things like that. So all these resources can be definitely helpful for children. I know, no, I don't do this, but a lot of uh, therapists I know, they use art therapy, music therapy for children, right? How they can be beneficial, right, at a young age to communicate in terms of what they're feeling. So I think those are some beneficial, I guess, in terms of they're very beneficial in terms of mental health and maintaining mental health. So yeah, maybe we can post some resources, or I don't know if it's possible.
Yeah.
I think even showing them, this recording, or finding YouTube videos or podcasts, there are a lot about, men's mental health and things like that. But I think for parents, the most important thing, at least mostly, it's like their kids. So if it comes from you, if you tell them how much it means to you, men's mental health and things like that, I think that can be the most influential for them to introduce those at home and have them support it.
Yeah. Yeah, I think it's key. I think, we talk about how society can sometimes be a hindrance in regards to our mental health, but in some cases, society and technology that we have even right now is a great provider of support. I mean, you Google anything and it has those guidelines. So I think it's a great support. There's a lot of resources out there, but definitely I believe that we could post and acknowledge some resources that we find beneficial. Let's see. So we'll just do two more, and what we can do is just go through these ones quickly here. what are some tips for men who have trouble accepting the reassurance and assistance that this individual tells them? They say that it helps in the moment, but loses power and meaning not long after. I think that's a good one as well, is because I find that in the moment they're fantastic and they have that strength, but then once maybe society or reality kicks in, it re-evaluates and reignites those feelings that they were having prior to coming to visit. So would you both have, tips to help continue the process even outside of the session?
Well, one of the things I often tell my patients is that a lot of the time therapy happens outside of the therapy room, right? It's, you learn the skills in therapy, and then you use them outside, right? So a lot of time, what we learned is just how to deal with thoughts, how to deal with relationships, right? Relationship, they might look, down on you for seeking therapy, how to deal with this, right? How to deal with, what emotion comes up, okay, and how to deal with it, and then really sit down and figure out, is therapy, working for me? And if it is, then why not keep doing it, right? And if it's not, then I mean, we will have to have a talk and see if it's not working, then why it's not working, and then tweak it or come up with a solution.
Yeah.
So yeah, so I don't know if that answers the question.
Yeah, absolutely. Yeah. Alizar, what are your thoughts on that one?
Yeah, I think that everyone has their own kind of timeline of when they want to change and how they want to change, and if they want to share and when they want to share. So everyone has kind of their own course in that. So I think like pressuring them or kind of putting that idea of, I give you this reassurance assistance, you should be able to maintain it in the long term, but you should be able to do this, kind of puts pressure on them even when they're might be not ready for it. So I would say just, giving them the space, giving them the non-judgmental kind of space to express themselves whenever they feel comfortable, whenever they're ready, and eventually, they will reach that in their own time.
Yeah. Yeah, I think it's that process. It takes time. Everything, and I always would talk to my, clients and people that I help out, is just like the gym, it takes time to build that structure and that foundation that you're looking for. So be patient. And I think patience is difficult, but I think it's very important to let them know that in time, like fitness, like sports, like becoming the next Wayne Gretzky, it takes the time and the process and the effort to put in. So sometimes you have to put it in a way that they are relatable to that. So the last question is extremely relevant to everything, and this question is: a teenage male wanting to go enjoy his life in the final years of high school, but comes the pandemic. How to deal with this frustration? And I think now more than ever, so relevant is we had expectations prior to the pandemic. And now, unfortunately, due to that, things have changed. And I think we're becoming a lot more aware of our cognitive and mental health issues. So, what would you say are tips for people that potentially are still in this position of lockdown or unable to have that human interaction? What would you say are the tips for that?
Mm-hmm. Yeah. So first thing I would say, let's validate, okay? Let's make sure that we understand this is a challenging time for most people, right? So take the time, validate, okay? What emotion comes up? Also validate that, right? Now, one thing is flexibility. I think we also kind of have to be flexible. Of course, we cannot do the things that we used to do. Okay, it's not maybe safe for us to do. So we have to be flexible. We have to find alternatives, right? If we have psychological rigidity, right? It's like this way or the highway. Okay, most of the time we're gonna get anxiety. So we have to also psychologically be flexible. So even for me, I used to love sport. Like I still love sports, but before COVID, I used to like every week go play volleyball and soccer with my friends. But now I can't do that anymore.
Mhm.
right? And that affects my mental health. So I need to figure out a way that can be helpful for me. So either going for a walk, going for a run, or whatever it is that I can do, but actually keep that cycle going about self-care. And
Mhm.
then this is the time maybe also reach out to a therapist and talk about your struggle, because a therapist and you can come up with plans that might, it's a challenging situation right now, but the suffering, the psychological suffering could be, we can decrease that or we can get rid of it. Even, if it's, even though if it's a pain, even though it is painful for a lot of people.
Mhm. Yeah. And Aliza, what are your thoughts, your final thoughts, I guess they would say, your final thoughts on that?
Yeah, I think I would echo everything Himal said, that self-care is very important, and um, that should be kind of the focus as well. And to say something more kind of practical in this regard, like the pandemic really damaged a lot of the social life and interacting with people and friends, and the final years of high school are very important for making friends and enjoying life, like the person said. And I would say, like, finding ways around it, finding ways to connect to people, even during this time, whether it's a phone call, a video call, playing games through the internet, or social distance walks, or anything like that, that in the meantime, and then when kind of the pandemic is hopefully over with and life is back to normal, you can enjoy and kind of celebrate those achievements of finishing high school and with all the friends then. But right now it's kind of like, how can we stay connected with those people that mean a lot to us, with the friends that we have, that we build throughout our high school career. We built so many friendships and things like that. So how can we maintain those and enjoy life in this moment? And I think there's a lot there to also uncover and to also find. And I found that many people found those relationships more meaningful because it's so one-on-one, and it's so in private, that people were able to kind of build lifelong friendships even because of this pandemic, because joining those different groups. And I think there is an opportunity here as well. Um,
Yeah. And I think that's the key is we have now the ability to truly kind of be one with ourselves, or be one with our individuals and partners and relationships and families. And we're learning a lot, not only about ourselves, I'm sure we all are, even ourselves are learning a lot more about just truly how we're feeling. And because of the process of, work, we never realized these issues were present. And then now having this opportunity, hopefully we can gain from it and build that kind of foundation of knowing that if something else happens down the road, we have that ability to stay strong, right? So, I think that's huge, and that's a huge opportunity. So, again, I think it's key. There is one more question. I hope you guys, okay, you want to just briefly answer this one question, because I think it's, again, very important at this time. All questions are important, but this one's important. If you guys are okay with this.
Yeah, of course.
Yeah. So this is a great question. So can the stigma of Afro-American or Caribbean Canadians be looked at? Is it looked at now as a direct diagnosis, as the Indigenous person's situation is now being looked at more objectively? And that's, again, really prevalent to the situation that we are, especially in Canada right now, in.
Mm-hmm. So, sorry, is it okay if you repeat the question?
Yeah. So I think to get to kind of read that and understand it, I think is the stigma behind it. It's like, being in an Afro-American or Caribbean Canadians, is there a stigma behind it? Do you find that there's a stigma? And, again, with the Indigenous person situation that's going on right now, I think, again, we're looking at this in an objective way to see that we are neglecting in some cases that support. That mental health support in the kind of the cross-cultural side of things.
Mm-hmm. Yeah, I think, more support is needed, right? There's no doubt about it. So, and since we're talking about men in general, right? If you try to find support for men, I personally think, you know, we can do a lot more. But then I also think just for everyone, we can have more support in terms of mental health, no matter who you are, right? Now, when it comes to the cross-cultural stuff, definitely, okay, we need more support, right? And again, and then we talked about it, you know, having therapists that are they understand the cultural aspects of it, right? Is very, very important. So bringing that now, whether it is in terms of education, where you know we go to school and of course now you know there is the class where we learn about different cultures and how to provide therapy to people from you know different cultures, right? But also review the literature, right? Review the diagnostic criteria and then see if there's any scope for improvement. And again, same thing with finding help, right? We need more funding, I would say, right?
Yeah.
Right, because you know that's important for a lot of people who doesn't have the means to get therapy, right? So that's something we have a lot to do in that realm.
Yeah, we have a lot to work to do, I think, is I think in kind of like that whole aspect of that question is we have a lot more work that we need to do. And I think it's now becoming more prevalent, especially with everything that's going on, that cross-cultural support is even more needed, I think, more than ever. Would you say the same, Alazar, as well?
Yeah, for sure. And I would say that, you know, in Canada, we have the privilege of having so many different cultures and diverse backgrounds that, you know, the awareness is key here. It's to introduce those cultures to, I know there's different fairs that was going on before COVID that, you know, show the different cultures and their traditions and their foods and all of that. I think that's a big, you know, thing that can help people be more aware and more understanding of other cultures and other people. So definitely, you know, increasing that would be a huge help.
Yeah. Well, I want to thank you both big time. It's one of these things where I think we could be talking until probably tomorrow morning, until our computers explode. But I want to thank you both. And on behalf of PsyMood, which was presenting and giving us this platform to talk about men's mental health and cultural taboo, PsyMood is also now going to be offering a free 15-minute intake session for users and are giving 100% off on the first paid session, which is absolutely amazing. We thank them for doing that. Using the promo code is 100% off, and it's valid until July 4th. So you would go to their website, www.psymood, which is PSYMOOD.com. And there you can find all the social media links to be able to follow them on social media. But the promo code again is 100% off, valid until July 4th. And again, just remember when it's 100%, the little percent symbol, even myself, I have to remember to use that. So again, it's 100% off, valid till July 4th, and just visit psymood.com to be able to, you know, get your free 15-minute intake for any of the users and 100% off on the first paid session. So both of you, I can't thank you enough. I know this will not be the last time that we speak. I hope we have many, many more conversations, because I think as we were talking through this whole period of time, the more talking we do, the more safe places that we provide people, whether it's digitally or physically in our offices or in our homes. I think the more we talk, the more action is being taken. And we all know that cultural, cross-cultural support is needed. And it's an honor to be able to provide, you know, this kind of opportunity and have PsyMood that is providing this service and program to cultures of all diversities and backgrounds. I think it's absolutely amazing and absolutely needed more than ever. So I thank you both for your time and for, your patience answering all those questions.
Yeah, thank you, Ross, and thank you, PsyMood, for doing this. I'm honored to be here. So thank you. Yeah.
And thank you to all the attendees who came and watched us. And I hope this goes to many more people once it posted on Facebook, and we create as many safe spaces as possible, like Ross said. So
and thank you for great questions. Those are very good
absolutely
questions.
fantastic. Again, everyone for attending, thank you so very much for your time, your patience and understanding, and your questions. And I promise you this will not be the last time that you see the three of us, I'm sure, on a webinar. So I wish everyone a wonderful evening, a wonderful weekend ahead. And thank you all very much for being here.